Dr. Carey. What's your name?
I'm Julie's niece.
Okay. Hi, Julie. You don't look too good. Let's get you over here to the bed.
Any questions, guys?
I don't feel good.
Do we have any questions out there?
All right, lay down right here. Got this pillow for you. There you go. So tell me what's going on with your aunt.
Well, she was really short of breath walking in here, and she's been feeling lethargic and saying that she feels full and not eating anything. And she's been losing a lot of weight.
Yeah. Okay. That sounds like something I've heard of before. We're gonna have to run some tests, maybe an MRI, CAT scan, kind of see what's going on in there.
A few moments later.
All of a sudden, I'm so sorry to say this, but it looks like your aunt has an advanced non-Hodgkin's lymphoma.
What is that? Is that cancer?
Yes, non-Hodgkin's lymphoma is a cancer that affects the lymph nodes. We took a CT scan and an MRI on your aunt, and it looks like she's in the third stage of the disease, which involves both sides of the body above the diaphragm and spleen. Luckily, the cancer has not progressed to stage 4, which would mean the cancer has spread to an extranodal site and in the lymph nodes, and is also in more than one extranodal site, for example, the bones, lungs, or liver. There's some earlier stages as well. I could tell you more about that. You said your aunt has been feeling lethargic. Has she had a feeling of fullness and has been having like a low-grade fever?
I mean, she seems really tired all the time, and she's been losing a lot of weight. I just thought she had the flu or some other illness, but other than that, she hasn't shown any signs of pain.
Okay, well those are some of the symptoms of the disease. I am not surprised she hasn't been feeling any discomfort, because when the lymph nodes swell, the patient usually doesn't feel any pain. Has she had any shortness of breath, difficulty breathing, or coughing symptoms?
Yeah, definitely. She's been experiencing some of those. How much do we know about non-Hodgkin's lymphoma? Does it have historical significance?
This disease, yeah, it does. This disease was discovered in 1832 by Thomas Hodgkin. He described incidents of people with cancer that appeared to affect the lymph nodes, leading to the name Hodgkin lymphoma. In 1856, Samuel Wilkes noted a different type of lymphoma that lacked the defining features of Hodgkin's lymphoma. These more varied and far less understood cancers involving the lymphatic system were grouped under the same non-Hodgkin's lymphoma. As the 5th most commonly occurring cancer in both men and women, there are approximately 19 new cases per 100,000 persons in the U.S. each year. Central pathogenic mechanisms include immunosuppression, especially in relation to T cell function, and loss of control of latent EBV infection, and chronic antigen stimulation. Some degree of familiar aggregation also implies a role for genetic susceptibility. Either primary or genetic disorders of immune dysfunction and acquired states of severe immunosuppression, so HIV or AIDS, or organ transplantation, constitute strong and well-established risk factors for NHL, or non-Hodgkin's lymphoma. But explain few new cases in the general population. Important aspects to consider for the disease include location, disease, spread, indolent, aggressive, and very aggressive lymphoma types. Non-Hodgkin's lymphoma is more common in the developmental world, with the highest incidences in the USA, Australia, and New Zealand, and Europe, and the lowest in Eastern and South Central Asia. You said your aunt has a liver transplant about 5 years ago and is taking immunosuppressive drugs?
Yeah, she has, and her immune system hasn't been the best, but we don't want to risk her body rejecting the new liver.
I see, that could have been a factor for developing this disease.
But can it be cured? I love my aunt so much, I can't imagine losing her.
I get it. If the cancer hasn't progressed to an advanced stage, it is possible that it can be cured. Unfortunately, your aunt is a much more advanced stage. We would have to use more aggressive treatments such as radiation and chemotherapy. However, chemotherapy causes vomiting, nausea, hair loss, and immune system suppression. These symptoms cause infections, bleeding problems, and general fatigue. Fortunately, these symptoms can be managed with medications, and sufferers can potentially lead normal lives after the chemo treatment. If you're interested, I can tell you more about the different therapies we can try instead of chemotherapy.
Yeah, chemotherapy sounds awful. I'd love to hear about some of the different options.
Okay. There are 3 interesting treatment options we could try for your aunt. The first option is targeted therapy, which uses drugs to identify and attack species types of cancer cells. Monoclonal antibody therapy is one type of targeted therapy. These antibodies are made in a laboratory and function in 3 main ways. They kill cancer cells, inhibit cells that assist in cancer cell growth, and keep cancer cells from spreading. Monoclonal antibodies could be given to your aunt by infusion. So immunotherapy is the next option, more specifically CAR T cell therapy, and it's probably more of a second alternative. Some of your aunt's blood would be taken and this T cells extracted. In a lab, the gene for chimeric antigen receptors, the genes for chimeric antigen receptors are inserted into the T cells, creating CAR T cells. Millions of these cells will be grown and infused into your aunt. CAR T cells multiply in the blood and bind to the surface of the cancer cells, killing them. This is especially effective in treating large B-cell lymphoma. That has not responded to treatment. We could look into this option if other treatments aren't successful. Okay, so the next one, the last one, is done more after treatment is completed. So it's called stem cell transplant and would be the last step. With this form of treatment, large doses of chemotherapy or radiation are given to the parent or patient, and then the blood-forming cells destroyed during treatment are replaced. Before the chemotherapy/radiation is administered, stem cells are removed from the blood or bone marrow of the patient or a donor. They are stored in cold temperatures. After the patient is done receiving treatment, they will receive stem cells through infusion, helping the body to produce healthy blood cells.
Wow, you've given us a lot to think about. I'll have to do some more research. But what can I expect her quality of life to be? Is there anything I can do to help her right now?
Yeah, anxiety, stress, and depression are common with NHL or non-Hodgkin's lymphoma due to uncertainty of outcome from the disease and the quality of life for the individual. This disease can spread to the organs such as lungs, liver, or bone marrow, causing additional complications and pain to spread throughout the body. Sometimes when the disease is caught early or is well managed, people with the disease can live active lives. Quality of life can be helped for these people that suffer from non-Hodgkin's lymphoma with strong support systems, including family, friends, and support groups. Many people find comfort in knowing others have empathy toward them and listen to what they are going through with their disease.
Okay, I'll definitely do my best to be here for her and show empathy. Thank you for answering our questions. I'll talk to her and maybe get back to you today about some of those treatment options.
Okay. So great, that's awesome. Better sooner than later. So let us know right when you decide. But one last thing I did want to talk to you about. There's some potential dental related side effects or considerations you have to take. So if your aunt needs any dental work, we'll have her see her dentist, and preferably 4 weeks prior to any treatment. We just want to make sure everything that was done is completely healed. If your aunt decides to go forward with chemotherapy or other immune suppressing therapy, we will need to discuss her potential need for prophylaxis. Her immune system will be weak, so we want to make sure her body can fight any harmful bacteria that enters her bloodstream during her regular cleanings. Additionally, before any invasive dental procedures, it is also important for her dentist to be in contact with me to make sure your aunt's blood tests are normal. It will also be best if she schedules her appointments after her blood counts are normal and just prior to their next round of chemo.